At the end of the show, we'll read some more of those comments for you. Guys?
This is Dr. Glenn Gallaspy from Azalea City Physicians for Women on the campus of Springhill Medical Center, and today you've joined us to talk about menopause.
Yes, thank you for having me back.
Thank you for being here. Now, when do we need to start thinking about menopause? At what age?
Well, the average age of menopause is 51, but the transition through menopause can be up to 5 years, and usually ranging between 45 and 55.
Okay, so really need to start thinking about it. What are the symptoms?
Well, the symptoms most people are familiar with are the hot flushes, the night sweats, the mood changes, sexual dysfunction, and of course, menstrual irregularities.
This is something all women are going to experience at some point in their lives.
This is a completely normal part of life where female hormones decrease in their production in the woman's body, ultimately leading to a cessation of menstrual periods.
Now, when you start experiencing these symptoms, you go see your doctor.
Correct.
And what are the treatments?
Well, there's many treatments. For mild symptoms, you know, people can just do behavioral modifications, and that may be enough. But Church, most of the women that I talk to are severely affected by these changes and require medical assistance.
Now, as far as coping with menopause, do you have any suggestions for that?
Well, there's some easy things women can do, just behavioral changes like I noted, sleeping with layered clothing, turn down the thermostat, avoiding smoking and caffeine. But then there are medical treatments such as hormone therapy with progesterone and estrogen, as well as some non-hormonal therapies like sleep aids and antidepressants to help get through this difficult phase.
Now, we talked a little bit about hormone therapy last week, but talk a little bit about the benefits and also some of the risk factors.
Well, the benefits of hormone therapy are they counteract the symptoms such as hot flashes and night sweats and mood swings. They also protect women's bones from osteoporosis. Some of the risks we have to understand is that with hormone replacement or hormone therapy, there's an increased risk of breast cancer, an increased risk of blood clot, and stroke. So women with these problems need to avoid hormone therapy, and that's when you would use the non-hormone therapies we just talked about. Also, women that may test positive for the breast cancer gene should avoid hormone therapy.
And it's all something you can talk to your doctor about.
Right, that's why we treat every patient individually when it comes to hormone therapy. Different people need different types of medicines.
Do you have anything else that you would want women to know that are watching now that you could tell them about menopause?
Well, other than it's a normal phase of your life, it's not going to last forever. Your doctor can help you get through it. And another safety concern would be just distinguishing between FDA-approved and non-FDA-approved hormone therapies. I write plenty of hormone therapies, but I want to use an FDA-approved one that's been rigorously tested for safety and quality.
Of course, and I think that's what everyone would want, to know that they're taking something safe.
Absolutely.
And you mentioned how long it lasts. About how long does it last? On
average, menopause lasts 4 to 5 years for women.
So just something to deal with for about 4 or 5 years that we can all look forward to, but not really. Okay. So if you have any questions, you can go visit Dr. Gallaspy over at Springhill Medical, Azalea City Physicians for Women. Thank you so much for being here and telling us about menopause.
My pleasure.